On the heels of President-elect Donald Trump's announcement that he's picked Robert F. Kennedy Jr. to lead Health and Human Services, pharmaceutical stocks plummeted. Kennedy has a long history of spreading misinformation about vaccines and other health-related issues. Vaccine makers Moderna, Novavax, and Pfizer tumbled amid concerns about a possible hit to profits.
And Kennedy, along with Trump's other staff nominations, still need a confirmation from the Senate to get the job. But Colorado Governor Jared Polis was quick to endorse him as the nation's next HHS secretary.
That endorsement went viral, but also left a lot of people scratching their heads. Denver 7's Brandon Richards shares how Kennedy's nomination has doctors in Colorado worried.
The last few years have taken a toll on Colorado doctors. They've been praised for their work during the pandemic, but also threatened. No wonder we found many reluctant to weigh in on Robert F. Kennedy Jr.'s nomination to be the next Health and Human Services Secretary.
There's a lot of trepidation in my line of work at this moment in time when you have the current nominee for HHS being discussed.
Dr. Ross Kettle, a professor of immunology at the University of Colorado Anschutz Medical Campus, is not afraid to speak up.
It should give everybody pause.
He's not concerned with RFK Jr.'s pledge to shake things up.
Every administration moves things around a little bit. We're all kind of used to that.
He says Kennedy lacks the qualifications.
His sole qualifications for this job is that he happens to have captured the ear of the president-elect. And I don't know, I guess he's an environmental lawyer. It's not entirely clear to me what his qualifications for this are, other than the fact that he's really angry about vaccines and he can't accept the mountain of data that say it doesn't cause autism.
The claim vaccines cause autism has been refuted by doctors.
And it's been completely debunked, and it is not true science. But there is lingering effects of people worried about this.
Yet Kennedy has found plenty of support, including Colorado Governor Jared Polis, who said he was excited by his nomination. After getting pushback, the governor's office clarified his position, saying Polis disagreed with RFK Jr.'s position on a host of issues, including vaccines, but said he would appreciate Kennedy's pledge to lower prescription drug costs and promote healthy food choices.
First of all, I'm not anti-vaccine.
For his part, Kennedy says he's been greatly misunderstood.
I can say right now there's no medicine for cancer that's safe and effective. It doesn't mean I'm out against all medicines. I've been fighting 40 years to get mercury out of fish. Nobody calls me anti-fish. What I want is vaccines that are proven safety.
Denver 7's Brandon Richard joining us in studio tonight. And Brandon, doctors also point out that vaccines do go through years of safety testing.
Yeah, that's right. In fact, they say that testing can last up to 10 years before a vaccine is approved. Independent scientists review tons of data about the vaccine, and even after the general public starts receiving the vaccine, scientists continue to monitor it. And they also point out that vaccines have now been given to billions of people around the world over many, many decades.
Controversial nomination. Brandon Richard reporting for us tonight. Thank you, Brandon. Polis also mentioned lowering drug costs in his post, quoting Kennedy, who said, quote, level the playing field for Americans internationally on drug costs, cap drug prices so that companies can't charge Americans substantially more than Europeans pay. Polis then said, quote, yes, Colorado currently has an application just sitting at the FDA for us to import low-cost prescription drugs from Canada, and we just need their approval. There are efforts to make prescription drugs more affordable here in Colorado.
So let's go in depth on what's being done to help save you money. The Prescription Drug Affordability Review Board was established to review and limit drug costs. Back in February, the board declared that the drug Enbrel was unaffordable for Coloradans and voted to set a price cap on the drug. According to the Denver Post, although a cap has not been set as a lawsuit works its way through the courts. Enbrel is used to treat autoimmune diseases and can cost more than $46,000 a year.
State lawmakers also capped the cost of EpiPens. More than 500,000 Coloradans use the life-saving medication. A law went into effect at the start of this year, reducing the cost from $700 to $60.
However, a Denver 7 investigation found multiple pharmacies were not following the law. After our investigation got the attention of Attorney General Phil Weiser, he sent a letter to pharmacies in Colorado demanding they comply. Now, if your pharmacy is not following the law, you can report them. We have a link for you to do that on denver7.com/investigates.